Hi, I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the CureCenter for Chronic Disease and CEO of Cure Coach Incorporated. I want to thank you for joining me on our YouTube channel. I hope you'll like this video and subscribe to our channel so that you get regular updates. And I hope you'll follow me on Twitter and on also on Rumble. Twitter, formerly now known as X, of course. So it has been suggested to me that maybe it was time that I tell our audience a bit more about my own personal story and journey and how I came to where I am currently practicing and delivering the kind of results that I'm very proud of, and in a way, in a practice model that is very satisfying and enjoyable. So I'm a 67-year-old general internist. I was educated at Valparaiso University undergraduate, and then Southern Illinois University School of Medicine for 3 years in medical school. Graduated, went through internal medicine residency here in Springfield, and continued on into practice here in Springfield. So I've been a Springfield resident since 1979 and practiced for almost 40 years now. And I practiced initially as a general internist with a group of other primary care, internal medicine, and family doctors. And our group went through a variety of different iterations. And in 2004, I had the opportunity to serve as president of the Illinois State Medical Society, which was quite an honor, especially at a time when our profession was going through a crisis on liability insurance availability and doctors were leaving. And so I still have a sticker in the back of my car that says "Keep Doctors in Illinois" from that experience nearly 20 years ago now. Prior to that, I had served as the president of the Foundation for Medical Care in Central Illinois, which negotiated managed care contracts with a variety of insurance companies back in the mid to late 80s, and I learned a lot about health policy and insurance companies and payers at that time. And that has served me fairly well in my other interests as a medical leader. I was a delegate to the Illinois State Medical Society House of Delegates, the AMA House of Delegates. Ultimately, I left there in, I think, around 2018. And so I also served as chairman of the board of the Illinois State Medical Society. So I've done a few things besides just take care of patients, and I really enjoyed my patient care experience. But in 2007, I would say I was probably a little bit burned out, and I decided to try something different and applied for it and got the role as the chief medical officer at St. John's Hospital. I had served as on the executive committee of the medical staff there for a number of years and had also served as president and past president of the medical staff at St. John's Hospital. So I had a pretty good relationship with the administration there, but also I think represented physicians well, because sometimes there is conflict, believe it or not, between the medical staff and the hospital's priorities. I served for 3 years as chief medical officer at St. John's and learned a lot about process improvement. I had a very strong focus on patient safety, dealing with adverse events, trying to reduce patient harm. And for the most part, I enjoyed my time at St. John's. I felt like it really did some good for the quality of patient care and got to know a number of colleagues very well and learned how organizations operate and being part of a team. But you know, in 2010, it seemed like it no longer was a very good fit. Won't go into all the details about that, but ultimately I left there in November of 2010 and tried to figure out what I wanted to be again when I grow up. So took a couple of months off. In May of 2011, I opened my practice as Craig Bax, MD, personal medicine. At that time, it seemed like the best option for a solo practice was a concierge model. Patients pay an additional fee every year to have a heightened level of access, more quick access to reactive care now that I look back on it. Not much different in terms of the overall care, but nevertheless, we felt that if you get in to see your doctor, didn't have to wait days, that it was a better, more satisfying experience and would lead to better outcomes. It was during that time that I had my first ultrasound at a lipid meeting, and it was kind of a curiosity. Never thought of having ultrasounds of the carotid arteries to see if you had arterial disease before you had a stroke. It was always after having a stroke to figure out why did you have a stroke, looking for blockage. But nevertheless, it confirmed that I have arterial disease, and like my father, who had 3 stents, my grandfather died of heart failure, prostate cancer. My mother, by that time, had atrial fibrillation and had suffered a stroke, had type 2 diabetes, and so I knew that I was probably genetically and lifestyle-wise in some trouble. I had been taking a statin, but I was at least 70 pounds overweight, and so I got to investigate what else could I be doing to improve my outcomes. And by that time, I'd also gotten involved, dragged into a CrossFit gym by a trainer who asked me why in the world, well, not so many words, it was a little bit more graphic than that, why in the world as doctors don't take better care of ourselves. And he used me as a subject to prove that, with better nutrition and exercise, cutting out sugar, and then subsequently learning to do intermittent fasting or time-restricted feeding, that you actually could reverse these chronic conditions. And so I found some success for myself, but I learned about the Bale-Doneen Method for prevention of heart attack and stroke. I attended my first preceptorship. I was intrigued by their value proposition that they would offer a money-back guarantee if you had a heart attack or a stroke under their care, and that they had not written a check for nearly 10 years in doing so. I was a little skeptical, thinking that perhaps I was going to have been fooled, or that I would have to change everything if in fact this turned out to be true. Well, determined that there was something to this and I should be looking into it not only for myself but also for my patients. And then I got to thinking about the whole process and decided it had to be digital, it had to be delivered in a way that could be done via telemedicine to meet the most people. So I decided to rebrand my practice from the Center for Prevention of Heart Attack and Stroke to the CureCenter for Chronic Disease, thinking that if you tell somebody that they have a disease, what do they want? They want a cure. If you tell somebody that they have a little bit of cancer, the goal is cure before it progresses into a moderate or a lot of cancer. But ultimately, I decided that I needed a plan to scan just about anywhere, anytime, and that's where the butterfly ultrasound came in. After I had experienced 2 prior personal point-of-care ultrasound devices, which are both now either expensive paperweights or in the recycle bin. So with this process now, I can not only screen patients, but now we have a process where we actually can measure their arterial age and follow them along using a protocol using the butterfly and the ultrasound interpretation for a basometric carotid intermediate thickness ultrasound. So for my own personal story, one of the things I want to point out is that I at one point bought into the idea that maybe the statins I was taking were causing me problems, and so I went off of them for about a year. But when my arterial age went up by about 15 years in 1 year, I decided maybe it's such a good idea to do that, so I went back on them again. So it came back down. So I practice in a way that's very evidence-based, very focused on data. If we don't see the outcomes that we're looking for, we go back to the drawing board and try to figure out why. If there are tests that we didn't do the first round or the second round, we go back and get that additional information and fill in the blanks. You might say, why don't we do everything all at once at the very beginning? Well, not everybody needs it, and if you drive the cost up by doing things that are unnecessary, or you get tests that you don't really need, you end up with a lot of red herrings and chasing your tail. But the really fun thing to say is that in 10 years, I have not had a patient suffer a heart attack or a stroke under my care. I've had one patient need a stent, but it was actually to fix the complications of the stent that he didn't need in the first place about a year and a half earlier. And only one patient has suffered the need for bypass surgery. And we caught actually his problem developing, which I think was related to COVID or possibly the COVID vaccines, that he had been stable for quite some time and then suddenly became less stable and had progressive disease. Suddenly, he had early type 2 diabetes as well. So I'm very happy with the results that we're getting. They're better than I ever got before I learned about the Bale-Doneen Method and how to reverse heart attack and stroke, and implement it in my practice. And I'm very happy to see patients who are actually getting better, requiring less medication because they're avoiding the bad S's. I call them the sweets, the starches, the snacks, the sitting, seed oil, stress, salt, smoking, and sleep disturbance. So the bad S's. We use body composition analysis to monitor changes in body fat and body muscle, get into the details. And frankly, the body composition analyzer, which we affectionately refer to as the judge, tells the story, and the patient rarely is surprised. They know what they've been up to. They've been doing well or not so well, and it helps them get on track and stay on track. So I'm really thrilled to be doing what I'm doing. I can hope to continue to do it for many years to come. I hope to train others to do the same thing and scale this up and bring this type of life-saving care so that we have the opportunity to die old and healthy, rather than by a series of deteriorating events and decrepit old age, and not be a burden to our children and our grandchildren, and have them be happy that we're still around and robust and active. And so I think we owe it to our loved ones to do that, to take care of ourselves, and that we should be an inspiration. We should encourage those that we love and care for to be proactive. Find out if you have a problem. Don't deny it if it's there, because it can be reversed in spite of what mainstream healthcare might tell you. One of the problems is that when it comes to chronic disease, I'm afraid that you as a patient are not the customer of the healthcare system. You are, in fact, the product, and your disease is important for the financial well-being of physicians, hospitals, rehab facilities that look at the cost of these conditions as their revenue. And so I think it behooves all of us to take our own responsibility for our own outcomes, be proactive, get screened, engage in an effective lifestyle and medical intervention so that you don't have to rely on a rescue intervention that may or may not make it and get you to the hospital in time for that stent or that embolectomy or that surgery. Thank you for listening to my story. I hope you learned something. If it makes sense to you, I'd be more than happy to work with you. Just go to thecurecenter.life and register for a free discovery call. Register on our CureCoach.app. And let's see if we can't identify and mitigate your root causes and cure your arterial disease and eliminate the risk of stroke and heart attack from your future. Thank you very much.